This month, we're looking at Stockley's Interactions Checker, the definitive interaction checking tool providing academics with quick and easy access to interactions between drugs, foods, and more. Our patient scenario this month. Mr. Smith presents to your GP clinic with a history of a productive cough, shortness of breath, and a high temperature. A chest examination confirms a low respiratory tract infection. Mr. Smith has a penicillin allergy and currently takes simvastatin for his high cholesterol. Which of the following macrolide antibiotics would be the safest option for the patient? The options include clarithromycin, erythromycin, azithromycin, or none of the above. There is no clear answer as to which drug to choose. This is a clinical decision based on the healthcare professional's own clinical judgment. The checker will help in the clinical decision-making process. To guide decision-making, click the Stockley's Interactions Checker icon below the search bar. Then type in simvastatin, followed by macrolides. So we know macrolides are the antibiotics of choice in the case of penicillin allergy. With this search, the powerful interactions checker searches by drug name or by drug class. The search will give 9 results, a result for each of the macrolides available with simvastatin. Each message consists of 2 short lines, the what happened part and the what to do, which gives guidance on how to manage the interaction. Each message also has 3 ratings, severity, action, and evidence, which are collated to create an overall symbol to give a quick visual guide to the action to be taken. Results are ordered by the symbol. This concise view of the interactions help users to understand how the clinical relevance of the effect and the management of the interactions varies depending on which combination of drugs within the same drug class is used, which makes Stockley's Interactions Checker an essential tool to both students and users within the clinical decision-making process. More detailed information about how to manage the interaction can be found in the link provided that takes you to the full monograph in the Stockley's drug interactions. Clarithromycin and erythromycin are both contraindicated on concurrent use with simvastatin, as both increase simvastatin exposure. High simvastatin concentrations in the body might result in something called rhabdomyolysis, which is essentially muscle pains and weakness. The point here is to show that despite the contraindication, the Stockley's Interactions Checker and Stockley's drug interactions gives further advice and suggestions where appropriate about how to manage the interaction if concurrent use is really necessary. For example, it would be appropriate to withhold simvastatin for the duration of the course of clarithromycin or erythromycin. There is not enough evidence to contraindicate concurrent use of azithromycin. However, in view of interaction with other macrolides, the Stockley's Interactions Checker and Stockley's drug interaction advise that the patient should be warned to report promptly symptoms of myopathy. To sum up, any one of these macrolides could be given as long as the further advice is followed.